Okay. Hey, well, thanks everyone for joining us. My name is Penny Longman. I am the Director for Information Security with the Fraser Health Authority out in BC. It's one of the larger health authorities in BC. We administer all of the healthcare for about 2 million British Columbians. And I'm also quite active with ISACA, which is one of our local security organizations. So kind of wearing both hats here. So, you know.
Greg Moshonas, Director of Cybersecurity Defense, working at Ontario Health. Fairly recent Crown Corporation by the provincial government, which consolidated several Crown agencies before that, leading the defense team in operations for security.
Yeah, so in our conversation today is around the importance of encryption in in healthcare and medical environments. So I'm going to just start a little bit with a conversation. So I've been in this role with Fraser for 3 years, coming up on 3 years. And I still feel like I want to keep saying that I'm really new, because I still feel that I'm really new, because I came from the private sector. And I've approached encryption in healthcare similar to the way that I approached medical device security, which if you know anything about medical device security, it's quite an eye-opening experience. One of the things I remember most as I started to learn about it was, seriously, you're not encrypting that? Because there's a constant, in medical healthcare environments, encryption is sometimes considered a nice to have, not a need to have. And it's very difficult to explain to the organization that I feel sometimes in security we did such a great job of making them realize, put everything inside the network and then it's safe, right? We did all that work, and now every time we say, you still have to encrypt it when it's inside the network, they're like, but no, it's inside the network, it's safe. So we've taught them that it's safe inside the network. Now we're trying to change them to tell them that it's not necessarily safe inside the network. So the value of encryption, we as security professionals understand the importance of encryption of medical personal health information in all instances, but it's still something that we struggle quite a bit with to get the clinicians and the larger organizations to completely appreciate the need for it. So I'll hand it over to Greg to talk a bit more about how we go about encrypting.
Definitely, yeah, and I'll start off with a story from several years ago as well in healthcare. It's my grandmother was in the hospital, and I remember walking through, and I was in IT at the time, and we were always taught, PHI is the holy grail, must protect it with at all costs. And there was a bunch of charts hung on the wall with patient information, including my grandma's. And I remember thinking, like, wow, they could have just put a cover page or something to cover that up, but it was just the full charts and the information. And then I thought, but hold on, we're working in IT and we're doing the same thing with millions of records when a system isn't encrypted, right? And I think that's the change that needs to happen within technology, if it hasn't already at each organization, where you think, it's not about why I shouldn't encrypt. It's the opposite, right? You need to encrypt by default. From a technical perspective too, it's more imperative than ever. As healthcare is always going through modernization efforts, but right now especially, where cloud is being adopted by many organizations, we're getting off legacy systems and off of the perimeter networks and whatnot, right? We need to start encrypting to make sure that foundation of security is there. If you start to look at zero trust and that core concept, there's the 5 pillars of identity, apps, data, network, and everything like that. It's across every single pillar of zero trust. So that foundation, if you don't have it in place, you have to go back to square one and make sure it is, right? So it's interesting with zero trust and the concept of assumed breach. You're flipping from the perimeter network, going to keep everyone outside, to I'm going to assume there's attackers inside my network, and I'm going to move away from that private network altogether. And part of that is making sure that your data just isn't exposed, right? someone inside your network operating will see a heck of a lot more if you're not following the principles of encryption across the board. It's one thing that I always find interesting too is when you have this conversation and everyone agrees to encrypt by default, but it's not being followed. I'll ask you, like, what do you think are some of the blockers and reasons at the business level that encryption isn't being deployed everywhere?
And like I said, it's been 3 years of sort of discovery for me to kind of understand the real reasons why encryption isn't as widely embraced. And I find it amusing because clinicians by default, they have a right to practice designation, they have ethics that they have to follow, they have strict regulations around how they keep paper charts private, and yet sometimes it's really complicated for us to have give that message to them around why this is also so particularly relevant for electronic health information. Somehow they sort of see that as two different things in their mind. Well, yeah, of course we wouldn't leave the charts. Why? Well, maybe they did before, but now don't necessarily leave charts out in the open. But the fact that there's all this PHI in a SQL database sitting out there practically with neon sign saying, "Come get me," that somehow doesn't necessarily frighten them the same way that it would if it was just a pile of charts. Soon after I started working at Fraser Health, I came across an article. It was written by a physician at a medical conference, and the title of the paper was, "Dear Security, do you want my password or a dead patient?" And it really resonated with me because it was kind of like, it kind of brings it home as a security professional, the how they might see security, right? I've always prided myself on being able to see the other side because I've actually not always been in security. I have a previous life in an entirely different discipline where security and IT, I was a customer of them. So I always feel that I have a good perspective, but that really kind of brought it home. But it also ties into some of the main blockers I think that we get is that it's just encryption in the public perception is it just slows everything down, right? It's going to slow everything down, slows down the connection, slows down the data, or means we have to buy more hardware to support the same size database, and we could be spending that on clinical, on some clinical equipment. So to me, one big blocker around it, aside from any technical aspects, is just around the perception that in the clinical world, that there's yes, it's important, but really maybe not important enough to spend the time and the money on. And I'm really welcoming, if anyone has any questions or comments, would really love this to be sort of more of an interactive conversation, because I really don't think we have to convince anybody here how important encryption is in health information. So please, if you have any thoughts or questions, just put your hand up. So Greg, what do you see as some of the technical or a particular technical blocker around encryption in the healthcare environment?
Yeah, definitely. You touched on some of them that are prevalent. It does take more compute power. If you're in the cloud, sure, there might be a higher cost. If you're deploying hardware, you might need some extra horsepower behind it. And also just the priority list, right? Like technical teams are being forced to constantly upgrade their application or deliver new functions for business. And encryption might not be the top of the list, but I think the switch that needs to happen is it's just there by default. It's not a debatable priority or something that can be pushed off. And thankfully, in the vendor space, there's so many different solutions and different ways to go about it now that there really isn't any strong reasons left other than legacy systems or areas that are tougher to deploy it to. But as they're modernized, if it's done from scratch, from square one, then it's very easy, right? If you're deploying 10 servers and you need an 11th to handle the encryption load, then that's what you do. Same thing on the firewall end or anything else you deploy. So I think really just having it as a mandatory requirement as you go out is key to success.
So you really feel that the overhead is really not something that should be counted as a valid concern?
No, I don't think so, because the thing is, this is a struggle at any public healthcare organization you work in. It's very hard to get people to see an ROI to it. But the reality is, especially in Ontario, but this applies to healthcare anywhere, is the IPC, Information Privacy Commissioner in Ontario, they deem that properly encrypted data, which has PHI, does not need to be considered PHI. And what that means at a high level, simplified level, is that you can rest a lot more assured, and you don't have to take a lot of different measures if it's properly encrypted. In the simplest form, a laptop, let's say, probably shouldn't have PHI on a laptop, but let's say it is. If that laptop is lost and it's unencrypted, if there's 10,000 patient records on that laptop, then 10,000 patient notifications are going out, 10,000 identity protection services need to be offered, and it's very extensive for something that could have been done for practically free in terms of having that laptop encrypted. Then if you apply it to systems where breaches might happen, the same concept, millions of records, if it can offer protection, it has a huge ROI. And I think that's when organizations, when they start to think zero trust, they start to think assume breach, it kind of clicks, and there's a massive ROI, and any roadblocks you have to deploying encryption are peanuts in terms of the value you get.
Yeah, and I think putting it so clearly like that, in that if this data was lost but it was encrypted, then it's not, I think tying it into some of the earlier conversations, it's not a material breach, right? It's because the data was encrypted. So barring any the odds are that there's nothing for the threat actor to use. So so some of the other sort of blockers that we've have, again, it's kind of around I consider it a little bit circular, but in our healthcare organization. So we have a PACS, which is a picture archiving, and for some reason I'm drawing a blank on the C, but anyway, it's where all the images are stored, right? And we're told that, well, we can't encrypt it on the device because it's not encrypted in transit, because it's not encrypted in the PACS. And I'm like, but if you just encrypt them all, then it can all be encrypted. So it's got to do, again, I think some of that again is just legacy misunderstanding potentially of the topic. But I think it also there are instances where, because of legacy systems, that you can't, that it flows downstream, and you can't necessarily put the encryption on the new thing because there isn't the encryption on the things behind. But do you have sort of any experience with any of that?
Definitely, yeah. I mean, there's the 7 layers from a technical perspective, and just because it's encrypted in one spot doesn't mean that it doesn't need to be in another. And there's always arguments about that, where to encrypt and where to not. But again, if you're doing it by default in any place you can, then you get that value from it. But it does remind me of another blocker I've heard, actually, ironically, from security. And when working with privacy in healthcare is if you encrypt, to be able to inspect your network traffic, you also have to decrypt. And that can create problems as well, because people want to know if it's being decrypted, where is that data going, what's being done with it. So, you do have to argue against encryption in some ways and balance that equation, but yeah.
Yeah, that you can't have, people say privacy and security go hand in hand, but I actually kind of feel they're often a little bit at odds, right? Because to have complete security, you need to be able to see everything, and that obviously kind of flies in the face of a lot of the need to know perspective. So any thoughts or questions or from the audience?
So I'm going to repeat the question. How do you deal with medical devices where they might not be using the same protocols, especially if they're older. Is that ever like a blocker for encryption?
Do you have?
Yeah, I would say it's definitely a blocker. I mean, with medical devices and a lot of healthcare, you're talking about outdated stuff that really can't be updated. The best thing you can do there is just throw security at it from all different angles, right? So, it's fun to move away from the perimeter network and go zero trust, but it's not going to replace the Windows XP, scanning and X-ray machine that's at the hospital. So, to some extent, you still need that perimeter network. And you can toss network-based tools at it that can offer encryption. There's also some good discovery tools out there that can show you what that device is and what it's running, right? So, there's always security holes in every organization. The most important thing you can do with those is, mitigate the risk, not solve it, and then have the awareness and build around it, right? So,
Yep.
Yeah.
One of my things also is if the device itself can't encrypt, then that's one thing. But what bothers me is when they're putting devices up that can't be properly managed from a security perspective, and then they Wi-Fi enable them, and then they don't, or they put them onto a network. They don't really potentially don't even need to be on the network. So a lot of the time you can solve your problems by just air gapping things and not connecting them to the network. And that's, as you said, sort of the mitigations around it. But yeah, we probably should have had the other half of this conversation around medical device security, because that's a whole other fascinating conversation. So I know, again, some of the discovery tools those can be extraordinarily useful, just in order to understand the nature of the devices that you have, what their risk posture profile is, what their vulnerabilities are. That, to me, with regards to medical devices and their security, that's a huge step up, is to just get some of the different, any one of the software out there that can do that, because you can't scan medical devices directly, right? They fall over. So you have to, you do the ones that do the packet inspection and that understand about the device from what it's doing. That's a really powerful way to mature your medical device security. So, yep.
Thank you very much. So while you were talking, I was thinking about all sorts of scenarios with regards to why we need to implement security controls. I know encryption is one of those controls. Being somebody who has dealt with a lot of compliance stuff, and then sometimes compliance could just be just making sure you check all those boxes, HIPAA compliance and all that stuff, high trust and all that. How, in your own profession, have you been able to balance the need, a risk-based approach versus compliance, especially when the business is saying, hey, this is going to cost us money, and then, we've been using these devices for the last 10 years, and there hasn't been any compromise or any breach of any type. So how do you manage that, helping the business understand and also balancing that risk, using risk-based approach to balance security?
Yeah, it's very much a risk-based. The goal is to take the organization risk-based approach and apply it to your medical information security as well. In that, you just have to accept, again, in healthcare, you just have to accept that there's risks that you are just never going to be able to address, either from a cost perspective or because they break a clinical workflow. Right? Generic accounts is one of them. In many instances in healthcare settings, you just have to give them generic accounts because you got 72 people all using the one device, and you just have to accept that. So that's not where you want the organization to focus their attention. With regards to medical security for the rest of the organization, it's very much looking at what are the vulnerabilities and the risks that you have, but also what are the ones that you can fix. That's one thing I don't hear a whole lot of when people talk about a risk-based approach. It's like, well, what are the most important things to fix? Okay, yes, but also what is the stuff that's really easy to fix, right? What are the things that we can fix with the simple purchase of, for instance, one of the device discovery programs? That can make a huge impact on your device security for what actually isn't an enormous outlay of funds. So it's that balance of what are the risks, what are the real what are the issues? What are the real concerning risks? And then what's the stuff that we can fix actually relatively easily to just kind of reduce the threat profile? So that's where I'm always coming from is, yeah, we have some really big, gnarly problems that are actually, network segmentation. That's a long-term program if you don't have it, to implement the segmentation, to move all of your devices. That's a long-term program. Short-term, get better inventory of your devices by spending a bit of money on a piece of software. So that's how I approach it in our organization, is that the combination of what's most important and what is some stuff that we can easily address. Did you have?
Yeah, no, for sure. I agree with all that, and it's a good question. At the end of the day, it's something I talk about with the team all the time, and it's not specific to healthcare, but it's definitely a big case in healthcare, is we'll never have enough resources to do everything we need to do this year or the next year, right? So what that means is we just have to nail the prioritization. If there's 20 priorities, we're probably only going to tackle 5 or 10, right? And making sure that those are driven from a risk, based perspective means you're tackling the right 5. And the note about compliance, it doesn't always compute, because you might have your top 5 priorities, but if your insurer says, hey, priority number 12 you need to have for next year, well, that's going to be priority number 5 or 6 now, right? So balancing the two is often difficult. Ultimately, all you can really do is take your best stab at it and just work with leadership to say, these are the priorities we have resources for. If you want us to tackle more, give us more resources. Otherwise, sign off and. Yeah.
And there's one thing lack of compliance is going to then be one of your risks, right? And that's what I said, okay, this is what we've got, this is what we can do, we're not fully compliant with certain requirements, that's another risk that the business needs to sign off on, so.
Yeah, that's a good question.
Thanks for the chat. Question on key management. How do you deal with key management? And the other question is similar, adjacent to that, is do you use unique keys for different data sets, or how do you do key distribution across your encryption?
Yeah, no, it's a good question. It's something our organization is kind of tackling now, but not solved, I would say. The key thing to me for key management is just as much automation as possible. The problem I've seen with managing keys is just it takes a ton of resources to do it manually. So we've had to compromise a lot in terms of the perfect way to manage keys and distribute them, and going for the highest possible security level with, okay, this is a non-production environment, or maybe this one is more internal, or the risk is managed elsewhere type thing, and you go with a lesser solution. And then taking your crown jewels and throwing everything at it. But the biggest thing I can say that we're currently tackling and trying to advance is that automation piece. If you can make key management renewals and different aspects more automated, you're going to get a lot more adoption from the different groups and whatnot. We have the product group approach where a lot of people are managing their own keys, and we're trying to convert from shared services where it's both of our teams, our security team managing keys for a product group and us working together, to more of a self-serve function where they can log in directly, get what they need, and it's a lot more automated in terms of everyday management. And then just, balancing the aspect of going for the best only where you need it, and then, making sure you have it everywhere, but you compromise in terms of criticality, for sure.
I don't have anything to add. Yeah.
Any other questions, comments? Anyone who's had issues or trouble at their organizations? encryption, security, anything? Yeah.
So in terms of using native controls, yeah, thank you. So in terms of using the native controls for encryption on each platform, is it wise to use those native controls and enable and manage? Or from an operational cost perspective, is it wise to go for a third-party solution to enable automation and other aspects?
Go ahead.
I was just going to say it's probably case by case. I feel like depending on the specific use case, would need to study what native controls are available and the advantage of going third party, right? There's so many third party tools now in security that it's getting just overwhelming for everyone involved, right? So where native does exist, my personal preference is to start there, and if native is good enough, then go with it. But where it's not, you know, if your arm is twisted, go third party would be my general, you know, take. But more than anything, I just think it's case by case, and you have to look at, you know, analyzing the threat against that product and whether native will do or third party is needed.
Yeah, there's even just over the last little while while I've been with Fraser, that's a constant conversation, because there's proponents for we'll go with the third party, and then it's, you know, simplifies things versus the native, but native doesn't cost as much. So there's no I think no easy answer to that one. It's very specific for the situation and the environment. So yeah.
It's a good question. Native will always be better than nothing, I would say, right?
Yes.
When laptop encryption was a new thing, right? There was a lot of good third-party tools that did an amazing job, and then you kind of had, it's got a lot better, but it wasn't always at the start. You had Microsoft BitLocker, which is the native tool, right? And, you know, if you have the money and resources to get the third party, I think that was the right decision, you know, when this was a newer thing 10 plus years ago. But if you didn't, just go in and check off BitLocker and go with native, right? So it's a balance of assessing the threat and assessing what you have resources and ability to deploy.
I have a question for the group. How many of you are in your organizations feel that that encryption in healthcare is not necessarily taken as seriously as it should? Am I kind of weird, or do most of you have a similar situation that it's not really taken not taken seriously, but not prioritized? Does anyone is in an environment where they feel that it is adequately prioritized? If so, can I come work with you? So everyone kind of feels that it's just never quite given the priority.
Because you're still responsible for those applications, no matter if they're on the premise or in the cloud or wherever, right? You still need that encryption, so.
Yeah, and I think that's something that's slowly just coming back. Well, it's fine. It's in the cloud. Google will keep it safe, right? And it's just slowly coming back. People are raising, you know, we're always fighting that the shared security model responsibility model in the cloud, right? They just feel that if it's there, it must be safer than on-prem. But
yeah, it's interesting too, right? When you're talking about the cloud, you're, you know, 10 steps closer to the internet for everything, which is absolutely great. But that's where you really need to focus on zero trust, and encryption is actually more important, right? Because with perimeter security, you're counting on keeping someone out. With the cloud, there's no perimeter to protect. Everyone is already in, right? And some of the stuff you can do in the cloud is pretty dangerous as well in terms of mistakes, and, you know, there's been a lot of breaches where it's happened. It just makes encryption that much more important.
yeah, poor configuration errors, and, you know, we've all heard the S3 buckets just sitting up there with, you know, no security on them. So.
No, I was just going to add to that. I think, like you said, it's based on use cases. Different industries, as an example. If you're I'm not in the healthcare industry, so if you're in the payment industry, as an example, some compliance requirement might be the drivers for that. Mm-hmm. You know, whether you want to encrypt locally or you want to, you know, delegate to a third party because you want to reduce your scope of compliance and all that. So the different use cases for deciding to use the native or local encryption versus wanting to use a third party to encrypt. Again, if you do not understand the private key, there's no way you can decrypt that data. So if it's a third party that has the private key, then only then they will have to be the one to be compliant to that particular security control. So again, in my own organization, one of the challenges we have is the application folks, trying to natively apply encryption in the application code, and especially in an environment where that was not the practice, and you're now, as a security professional, you want to bring that practice into the forefront. It becomes difficult. It's something, in my own experience, not something you can achieve overnight. You have to actually have a long-term plan, because then you have to change the codes, you have to work with developers, and then you have to set a policy in place. And I mean, there's all in the whole 9 years. There's a lot of work that goes into that process.
Yeah.
Thank you.
I'd turn it back to yourself. How do you work with business developers and things like that to make security a priority at your organization when you don't feel they take that seriously?
Yeah, it's a battle. I tell you it's true, especially in an organization where they don't have it as a culture. One of the first you want to do is to introduce the culture. Mm-hmm. Usually there's a pushback, but again, working with getting the business, the senior leadership buy-in, it means that that approach has to come top down. In my own organization, we use what we call security by design. So in part of our product development methodology, we have that as a gate where, if when you're designing your application, you have to go through that gate, mm-hmm. and it has to have a security sign-off before it goes into the release, before that application can be released into production. So again, we're not there yet. It's still work in progress. It's still trying to continue to change, work with the developers to improve that process, obviously with the buy-in of the senior leadership.
For sure. That's good insight. So next year we'll get a third chair, and you're up on the fireside chat.
Yeah, one of the big differences I find, because I was in mining before, and there's a lot of air gapping, right? So everything in this plant is essentially air gapped, because any of the automation, whatever, is often just. I'm not talking about where they're actually necessarily some of the ones where they're tracking the trucks and the autonomous trucks and sort of in the larger, but in the processing plants, there's often air gapping. So there's not a whole lot of encryption in at least from some of the work that we did in many areas, but then there's intensive encryption over anything that's considered their IP, or that's, if they've got any customer data or client data or geological data or anything like that, there's like enormous encryption here and then really not a whole lot everywhere else. And I kind of find healthcare is kind of different in that I feel like there's just a little bit of encryption everywhere. So it's just a comment around sort of how the different industries, the way that things like encryption is spread out throughout the industries varies quite a bit depending on the nature of the industry. And I will say, did not expect that. When I got into healthcare, I figured, encryption, that's got to be sort of a, standard requirement, and it's not, what's that?
Is it no budget?
Yeah,
No budget,
fair enough.
You'll get better.
Yeah, well, but I think it's also communicating, like we talked about, application developers, things like that. I think from a healthcare perspective, it's making the decision makers, who are often clinical, understand the importance of encryption. I have had a fair amount of success talking to them. It's like if you went, you don't leave paper charts. Of course, a couple of our hospitals don't even have paper charts anymore, but you don't leave paper charts around. So why would we put everybody's data into this one database and just put it there and not put the encryption? Like, surely it's extra work for you to close the file folder before you put it down. So we need to do that little bit of extra work digitally to make it so that it's as safe on our computer systems. And again, it's because they don't understand, well, you can't get easily into a database. Actually, it's pretty easy to get into a database if you know what you're doing. I think it's fabulous, and I don't know how to diagnose illnesses, so what you do I don't understand, but you don't understand what we understand, and that is that if data's not this PHI is not encrypted, then it's, you know, it's like candy all over the place. So I think what I'm working on at the moment is that sort of outreach to the decision makers, or as I said, often the clinical leaders, just to make them understand that you've got to be planning this right from the beginning. One of the checklists we have for them when they're looking at new solutions is, does it either support encryption, easily support encryption, or does the architecture you're planning going to involve encryption? Because again, then the vendors often are complicit as well, and it doesn't really need to be encrypted. So it's fighting that fight around procurement, making sure we're only right from the very beginning procuring, designing, and implementing systems that support encryption, and that, you know, you did the math around whatever the extra requirements are. So
For sure.
anyway, haven't won it yet though.
That sounds to me very silo. Like, you know, medical term, you need to have, thank you. Medical, you need to have encryption, or maybe the other hospital doesn't need to have. Is there a mandate coming to you to say every medical equipment or data needs to be encrypted, and there is no buts and if, and that's what you need to do?
So from a BC perspective, there is a requirement to, we have a requirement under our BC law, FIPA, to adequately protect the information of our citizens, the medical information of our citizens. So essentially in BC, at least, all of the regulatory environment around security stems from the requirement for privacy. So there's nothing mandating encryption, except that when in situations we need to protect our patients' data, it needs to be encrypted. But there's nothing mandating encryption per se, no. So
Okay, that's wrong.
I agree with you, but the government doesn't listen to me.
Hi, I came in late, so I don't know if anyone brought this up, but are you doing anything from an enablement perspective? I mean, it's one thing to go to the leadership and say everything needs to be encrypted, but what about teaching all the people who have nothing to do with technology and they're using the applications in hospitals, in offices, that sort of thing? So did they understand the importance of using these tools and why?
Constant part of our outreach is to educate people at all levels, because again, they might they might make small decisions around encryption or around the tools that they use. It's I would say 50% of my job a lot of the time is figuring out how can we start to get the message to all the right people, so that when they have to do sort of a little bit, I don't like to say make people do extra work, because the job really is to not make them do extra work. But when they have to accept something a little different, to make them understand the importance of why we do it. So yes, we're working on outreach in many, many different environments with the nurses at their stations and with housekeeping. The one we can't quite figure out is how to go with the community nurses, because really people don't want some random security person turning up at their home healthcare visit, But we're absolutely working on it, because I think that's one of the major things we need to do, is just better so people understand that it's critical to protecting, and also their own employee data too. Like, that's what gets me sometimes, is it's your own data too. And also, we're mostly patients of our own health authority, so it's our own data. So anyway, did you have any closing comments?
Only thing I'd add to that is, and you did a good job summing it up, if we're doing encryption and things like that from a security perspective properly, my hope is to the clinicians and others it's seamless. There's some parts of security where it's like, sorry, you got to do MFA, and I know you don't like it, but that's where the education thing comes in. But with something like encryption, I would just hope we're doing it for them and it's not a pain point. Their job is providing frontline care, and our job is helping them do it securely, right? So.
Yeah. All right, well, I think that's it. Thanks very much. Appreciate all the interaction, and hopefully you enjoyed the session. And
Thank you.
now we can, the bar's open soon.
Yeah.